friends, I'm Christina Rosebush. I'm here to share the results of an evaluation of the Minnesota Safe Patient Handling Act. This project was a collaboration between the University of Minnesota and the Minnesota Department of Labor and Industry. And we've completed the research portion of the project and are currently working on outreach. I wanted to share pictures from 2 direct care worker unions in Minnesota, an important audience for us. By way of background, the Minnesota Safe Patient Handling Act was enacted in 2007. It applies to nursing homes, hospitals, and most outpatient settings, though our research focuses on nursing homes. This group of facilities is required to have a written safe patient handling program, minimize manual lifting of patients by 2011, acquire adequate safe patient handling equipment, which refers to mechanical equipment like Hoyer lifts and sit-to-stand lifts, and create a safe patient handling committee. And that committee has to be comprised at least half of direct care workers. The law is supported and enforced by the Minnesota Occupational Safety and Health Administration, MCOHS, which provides a wealth of resources for getting your program up and running. They have templates for the written program. They have recommendations for running the Safe Patient Handling Committee, access to free ergonomic consultation services, where an ergonomist will come out and help nursing homes identify hazards and solutions. And they also host a matching grant program. So every year, nursing homes can apply for matching grants of up to $10,000 to help purchase and maintain their safe patient handling equipment. We used lost time workers' compensation claims data from the Department of Labor and Industry to answer the following questions. Have lost time workers' compensation claims for patient handling related injuries declined in nursing homes following enactment of the Minnesota Safe Patient Handling Act? And do trends in patient handling injury claims vary among nursing homes with differing levels of staffing and staff retention? We were also interested to see whether claims differed by occupational group. So certified nursing assistant versus registered nurse versus licensed practical nurse. We focused in on those direct care worker occupations. We found that overall, the law appears to have had a positive impact. Between 2005 and 2016, work comp claims for injuries related to patient handling declined by 38% across Minnesota, while claims for all other injuries and illnesses declined by only 20%. And we used that all other injuries and illnesses category as an internal comparator. We didn't have access to an external comparator, ideally claims data from a state without a safe patient handling law. Despite these promising findings, we also saw that there's still a lot of important work to be done. 45% of facilities did not experience any decline in claims over this time period. In fact, many of them saw an increase in claims. And we saw that claim rates were high in facilities with low staff retention, those that were in non-metro areas, were nonprofit, or were not affiliated with a hospital. We also looked at staffing levels, so staff hours per patient day, and claim outcomes, and we did not see any association there. We did see a signal of an inequitable injury experience for certified nursing assistants, which is of concern. Compared to registered nurses, CNAs were 2 times more likely to experience a patient handling injury claim, but only half as likely to receive traditional workers' compensation benefits, like temporary total or temporary partial disability. Instead, they were often receiving a lump sum settlement payout. For context, in Minnesota, CNAs are 90% Black, 5% Hispanic, 18% speak a language other than English at home, and 18% were born outside of the US. With this finding in mind, we're working with the Center for Healthy Aging and Innovation here at the University of Minnesota to develop key messages. The audiences we've identified are nursing home owners and managers and direct care workers. For owners and managers, we want to communicate that safe patient handling is one way by which to minimize costs and maximize quality of care. And we also want to draw their attention to potential barriers to health and safety among their workers. So are there areas that they need to provide clearer guidance. For example, for injury reporting, are there injury reporting materials culturally and linguistically tailored to their direct care workers? For direct care workers, we want to draw their attention to safe patient handling as a way to protect their health and income, providing guidance on how to navigate the workers' compensation system and information about the advantages and disadvantages of different workers' compensation outcomes. We also want to encourage them to participate in opportunities to improve the culture of safety and quality of care in their workplace. For example, joining a safe patient handling committee. We have several questions for how to best reach these audiences, and a few planned outreach events which are listed on this slide, but I would love to hear your feedback. If you're involved in the healthcare world or have expertise on occupational health in other industries, but ideas for healthcare, you can contact me either at my personal email or through Chai, both listed on the slide, or join the breakout session and we'll chat more. Thank you so much for listening and enjoy the symposium.